whether you're prepared to talk about integrative care, the program at all, but Manuela, I have to say, is someone who makes up for all of my deficiencies. Insofar as I'll see a patient that'll wait all too long in clinic, I'll see them in 15 minutes, 20 minutes. I'll try to decide whether they need another treatment, another scan, another blood test. I'll try to do what TLC I can, and I'm gone and seeing the next patient. And then the nurse practitioner says, "You idiot, George, didn't you see that that person needed more than that?" And so recently I've had the luxury of referring them over to Manuela, and to this day everyone comes back to me and says, "She is fantastic." So I don't want to build up expectations for So anyway, we're delighted to have Manuela, who's from our integrative program and supplies sort of supportive care and psychological help and sort of behavioral and coping skills. So Manuela, thank you.
After this introduction, I'm not sure what to say. Thank you. Thanks for having me. I'm something that's called psycho-oncologist, and what that means is I work with the emotional aspects of people that have cancer. So anyone who gets a cancer diagnosis, and not just the cancer diagnosis, can be another kind of trauma.
Can you adjust the microphone?
To me it sounds loud. To you it's not. Okay. There's a pretty specific response people will have when you are diagnosed with an illness. And so I made up some slides that are pretty universal, and they might not apply to all of you, but I'll walk through them because most of these things apply to some of you. And there are basically three phases. The first phase is, how do you respond emotionally when you first hear that you're sick? Then how do you respond in this middle phase of while you're going through treatment? And who are you, or how do you respond emotionally after treatment is done? Or presumably no more treatment after that, but I'll talk about that also. And so that's just, these three phases. And so I'm going to talk about the first phase. And sentences I often hear is, I'm sliding down a hill and there's an avalanche behind me, or I feel as if I just fell off a cliff. So there's this total, sudden surprise moment when someone is diagnosed with cancer or a tumor. And I know for a lot of you, the time between having some symptoms or something that doesn't feel right to actually hearing the word cancer sometimes can be quite long, because the tumors you have can present themselves not very obviously. They're easy to miss, some of them. So, but then once you hear that you have cancer, that word evokes a lot. In at least half of the patients, they have anxiety, they get irritable, they can't sleep, they sometimes even have thoughts of suicide. If any of those things you've experienced, it's normal. It's very rare for people to actually have psychopathology, like someone who might have had schizophrenia or depression or some mental problems before. And that can be very hard for people, because the majority of people just have these responses, and they're totally healthy, they're a normal response of a human being to being diagnosed, but they feel as if there's something wrong with me. They say, "Oh my goodness, now I'm mentally disturbed," and often don't seek the help that can be easily given. So if that applies to you, it's normal. If you take one thing from this talk today, whatever emotional experience you had in response to any stage of your illness, it's probably normal. So the typical things that people have to deal with at the time of diagnosis is this element of surprise I just talked about. It's like, why me? I have done nothing wrong in my life to deserve this. It's this element of unfairness. People start to question themselves. Did I do anything wrong? I should have eaten more carrots, or they're looking for cause and effect, and you're laughing, but when you're, there's a humorous element to it, but when you look at the suffering people experience, trying to figure out why me, it can cause so much distress that in itself is enough of a symptom that people have to deal with or seek professional help. They're trying to figure out what caused this thing, and they're going through the whole list of what potentially could have been harmful, when usually there is no causal relationship. Then, if you heard a lot about surgery and trials and medication and, a lot of things that you need to deal with, you need to make medical decisions. And that in itself can be incredibly anxiety-provoking because it covers a broad range. One doctor might tell you, why don't you do this? But then you go to Mayo Clinic or MD Anderson or someplace else and they tell you something different. And not having the expertise, not having the knowledge, and depending on people that have the knowledge and not always agreeing upon what's best for you, can be also very, very, very anxiety-provoking. Then I put up there change in relationships. There in your handout, there's a sad story of the patient whose mother killed herself 1 year after she herself was diagnosed. So it can be such a shock to families that all of a sudden, to a lot of people, it feels as if the whole system is falling apart. Most of us use a certain coping style under stress. Some of us, become very proactive and start gardening or knitting or become, need to do something. Others, they withdraw, they become quiet, they only want to read, they don't want to communicate anymore. And if that's different from how you used to be, it can affect a family tremendously. Some people say, I feel like I'm not the same person. And family members will report, I feel my husband, wife, brother, mother, whoever is not the same person. And that can also, it causes a lot of additional stress, because in a time of illness, we need friends and family support. And when these relationships change because of the stress, people are in for disappointment. People they thought were their best friend all of a sudden turns out aren't, that wonderful of a friend. And shift in needs. I touched upon that a little bit. We all, under stress, usually resort to what we're good at and feel comfortable with. So if I'm a master gardener, I'll double my time gardening when I can. Because that's what gives me comfort. When people are diagnosed with a tumor or with cancer, sometimes these needs can suddenly shift overnight. Someone who was gregarious and outgoing and they always want to hang out with their friends, all of a sudden want to be alone, don't talk to me. Or the other way around. It's often very, very unpredictable that people go through these changed needs that then, their surroundings feel like they've gone crazy, when in fact they just adjust in their own way to the catastrophe that's happened to them. Dealing with statistics, I put up there because that's also an emotional topic that's very, very challenging. And I talk a little more about it in the slide, how to deal with uncertainty once your treatment period is over. But statistics, are numbers that apply to a whole group of people. And they can be emotionally devastating. So, and I gave you just a totally arbitrary example, has nothing to do with anyone in this room particularly, but if I say 50% of the people have a 5-year survival rate, that means, 50%, 50 out of 100 will be dead in 5 years and 50 out of 100 will be alive. And that's pretty scary. But the problem is that you don't know which 50 you are. And so the statistics emotionally can be incredibly challenging, because what people's minds do in those situations is that they jump ship. one day they feel like they're the 50% or the 50 people that will live, and the next day they decide that they're the 50 people that won't live. And what's so challenging about that is emotionally is that ultimately you have no idea which group you're going to be in. And your mind will try to control that future, which it can't, but it will try to control that future emotionally by sometimes coming up with fictional catastrophic scenarios. I mean, I can have a patient that's, I know I'm not allowed to use the word cure in connection with cancer, but I do, because some people do get cured. You know, people that might have had a cancer diagnosis 30 years ago and never dealt with cancer again, and they're fine, and still their minds decide that they will die from their cancer. And there's a lot of emotional logic to that, but there's no statistical logic to that. So always be careful when you deal with numbers. Remember, the numbers apply to a group. They ultimately don't have so much to do with you personally. And that also leads to what I just said about the lady that might have been diagnosed with cancer 30 years ago and continues to know, even though she doesn't, that she will die from her cancer. And so when you catch yourself in thoughts about these catastrophic, and I call them fictitious scenarios, you know, sometimes unfortunately they turn out to be true, but when you catch yourself in going in that future, realize that it's your attempt at trying to control something that you ultimately can't, which, you know, I'll talk a little more on the last slide. How are we doing for time? 5. Okay, then let me skip. You know, this is the middle phase when you go through treatment. Emotionally, that's often the easiest part for people because they feel like they're doing something. At least I'm treating this tumor, so won't talk too much about it. I know physically it can be catastrophic, and we also do a lot at the Center for Integrative Medicine for, you know, treatment-related symptoms like nausea, or there are treatments for that. But emotionally, it's often a phase that's easier because people have something to do. So I'll skip this, and if it doesn't apply to everyone, there are people that struggle in that phase, but the majority of people do emotionally rather well. And this alludes a little bit to what I said about the lady who had her cancer 30 years ago and never had it again. During the month before my scan, I know that I have cancer. And that's a statement I hear over and over and over again, and it's the difficulty living with uncertainty. Most of us, healthy or not healthy physically, have a hard time saying, I do not know what the future brings. You know, most of us, you know, mentally settle into this, you know, comfort zone of, I don't know, I'm going to school, I'm going to college, I'm getting married, I buy a car, and I'll die in my sleep when I'm 80, surrounded by my 10 grandchildren. And that's something that most of us maintain until some trauma happens, and it doesn't have to be illness. You know, loss of a child, loss of a partner, car accident, road bomb blowing up in Iraq. It's any form of trauma will make us realize that this idea that life is safe is a total illusion, and most of us can suppress the reality that, you know, we can, I don't know, the ceiling could fall down on us in the next 3 minutes is something most of us don't actively live with. But someone who got diagnosed with cancer doesn't have the luxury to live in that illusion. The reality is always with them most of the time. And that's the hardest part that I see that people need to learn, is how do I learn to live with I don't know, I don't know, I don't know, I don't know, and it's okay. And emotionally, the mind, unfortunately, hasn't evolved enough in evolution to for most of us to be comfortable with that concept, whether or not we have a physical illness. Then appearance is also something people struggle with. You might have had disforming surgery and someone takes one look at you and knows something is wrong, and people ask insensitive questions or are thoughtless, or that's also something that people emotionally have to adjust to. How do I live with the fact that something is visible? Probably might not apply so much to this group of people, but women with breast cancer, or people with head and neck cancer, it's very common. So change in sense of self is something I mentioned in the beginning. So a lot of people have this feeling, I'm a different person. And that also takes some time to adjust to, who exactly am I now? I know who I was 3 years ago, but who am I now? And how can I get comfortable with who I am? And that, that goes in the reevaluation of values. So people often have a total change in outlook, what matters to them. And not so much that they quit their job and sell their house and move to Hawaii, but that all of a sudden values like spending time with family or doing activities that we usually, unfortunately, the activities of daily living often get lost, then all of a sudden want to do, and that can put a strain on the family, because if I used to be the primary breadwinner and all of a sudden I have cancer, and then my partner has to take over that role, and I now just want to hold hands and watch sunsets, that is a problem. And that can, again, evoke emotionally much more than people allow themselves to be true. Guilt for not optimizing health behavior, that's something that feeds into or connects to what I said in the beginning. The same way people say, how did I cause my cancer? Which cigarette was it that I smoked that did this? Same thing happens once they're treated. They say, I'm not exercising enough, and I haven't lost the 10 pounds Dr. Fisher said I should, and things like that. He actually didn't say that. And again, people create a cause and effect where there isn't. Whether or not you eat those 5 carrots will not make a difference at all. But what do you need as patient to get a healthy sense of how do I need to live, want to live, that feels right to me and my family and my friends, that I can be emotionally comfortable with. So as a closing remark, if you, in this course of this, difficult time most of us have had to go through, you ever felt angry, you ever felt sad, you couldn't sleep, you once wanted to strangle your partner, thought about driving off the cliff, it's normal. It's normal, 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 normal. If you feel like it's more than you or your family can bear, get help, since most of you don't have an underlying, psychopathology where, might be a pre-existing mental condition. It's relatively easy to fix. It doesn't take much. So if you can step over that threshold where you think, oh my goodness, I'm crazy, you're not, just take that step, and there's help out there. Because that aspect of the illness has a very good prognosis. Thank you.
Great. Thank you.
Yeah, so it's a huge stressor on the family, and you got to look at it as affecting the whole system. So we always think of, oh my goodness, now I'm sick, and we have a tendency to then just wanting to focus on that fact, understandably so. But however, you're part of a system that experiences as much stress as you do as a patient. And often, as in the example in the booklet, it can cause exactly the same symptoms that you experience as a patient emotionally. So also seek help. Don't be surprised. And in general, realize a diagnosis like this can be emotionally such a stressor on the family. You know, it's like equated to the loss of a child. So it's a huge stressor. Don't be, again, surprised at what you experience. There will be conflict, and there is help.
And for a newly diagnosed patient that is, might be hesitant to discuss this disease with their loved ones, they don't want to worry people or put it on others. How can a patient get past this and begin to discuss it with their support networks?
Yeah, those are all big questions. When you look at what prevents people from talking about it, are, as you say, often the protection of others. And in general, I say it's easier to deal with reality once it's on the table than avoid it. I mean, most of us are taught coping strategies to not bring things to surface, not deal with reality, and try to just keep things the way they were. But in general, focus on reality, whatever reality it is, but get help to deal with the emotional aspect of that part.
Thank you. And final question, in terms of exercise, lifestyle, wellness techniques, is there anything a patient can do to manage their symptoms or to manage their cancer growth?
Yeah, don't feel guilty when you don't go on that run every morning. People put a lot of pressure on themselves with the expectation, I have to live a perfect life. And that in itself is more stress on your system than figuring out what works for me. What do I want to eat? How much exercise will I get? Will I still smoke 1 cigarette a year or not? And it's very individualized. It's something that if you can remove guilt, then you're good.
Before you leave, Manuela, when I introduced our program this morning, I didn't really specifically address the integrative medicine program. If you could just give us a few words, a thumbnail sketch of what services are available. And UCSF has a very similar outfit.
Yeah, so at UCSF, it's the Osher Center. Here at Stanford, it's the Center for Integrative Medicine. And so we offer, integration can mean a lot of things. In part, it's conventional and complementary techniques. So you get your chemo or you get your surgery, but if you want to come get acupuncture because you feel nauseous during your treatment, or you have something that's very typical as anticipatory symptoms. Some people, before they go into the hospital and think about their treatment, get already sick just thinking about it. So the brain associates certain memories with physical symptoms, and there are treatments out there, like acupuncture. We offer massage. Hypnosis is a good treatment for those kind of symptoms. And then integration can also mean, and that would be my department, integrate the body and the mind. So what you experience emotionally is as much part of your body as your arms, your tumor, or your feet. And so it's hard for most people have a hard time realizing that when they have an emotional experience, that comes as much out of their brain as it comes to move your arm. So an emotion is not something that's detached out there in nirvana. That's this, abstract entity. It is a production of your body. It's, you will have these emotions, and, for people to tell you, don't be sad, don't be angry, it's as if I were telling you, stop going to the bathroom. You can't. You will have the emotion, but you can learn to deal with it.
Thank you very much.